Hi, in this video I will provide some literature on the anatomy of the internal abdominal oblique muscle, one of the four muscles found in the abdominal wall of the ruminant animal. After you've gone through this video on the anatomy of the ruminant internal abdominal oblique muscle, you'll be able to describe the structure of the internal abdominal oblique muscle, and you'll also be able to state its origin, insertion, action, nerve supply, and blood supply. In addition, you'll be able to name the anatomical structures that are related to the internal abdominal oblique muscle in the abdominal wall. To begin with, I'll be first describing the structure of the internal abdominal oblique muscle. Then I look at the other attributes of the muscle, such as its origin, insertion, action, innervation, and blood supply. The internal abdominal oblique muscle is situated beneath the external abdominal oblique muscle within the abdominal wall. Its fibers are directed ventrally, cranially, and medially. It is described as a triangular muscle in shape with the base directed caudally. And the fleshy portion of this muscle is well developed, and it is clearly fasciculated. It occupies the entire flank region from the coxotuber to the last rib. Its aponeurosis is divided into two distinct parts. The dorsal part is attached to the caudal border of the last rib and its cartilage, and the other part extends laterally or superficially to the costal arch to become fused with the aponeurosis of the external abdominal oblique muscle. Now, in terms of its origin, insertion, action, innervation, and blood supply, the muscle originates from the coxotuber and the deep lumbar fascia at the lateral border of the longissimus lumborum. It inserts on the caudal border of the last rib. It also inserts on the prepubic tendon and the linea alba. The aponeurosis of this muscle blends with the aponeurosis of the external abdominal oblique near the linea alba, and it also detaches a layer which assists in the formation of what is known as the internal sheath of the rectus abdominis muscle. The action of this muscle is to provide compression during processes such as urination, expiration, parturition, and defecation. It also supports the abdominal viscera. The nerve supply to this muscle is via the ventral branches of the first two lumbar and the last two thoracic nerves. It receives blood supply from the lumbar arteries, the cranial branch of the deep circumflex iliac artery, and also from the dorsal intercostal arteries. So that is the brief anatomy on the internal abdominal oblique muscle. This muscle is related to various structures on its superficial side as well as its deep side. On the superficial side, the internal abdominal oblique muscle is related to the external abdominal oblique muscle and also to the inguinal canal. On the deep side, the muscle is related to and is in contact with the rectus abdominis muscle, the transverse abdominis muscle, the quadratus lumborum muscle, the ventral branches of the first two lumbar nerves, and also the cranial branch of the deep circumflex iliac artery. You have now come to the end of this short lecture segment on the anatomy of the internal abdominal oblique muscle of the ruminant animals. Therefore, you should be able to describe the structure of the internal abdominal oblique muscle and state its origin, insertion, action, nerve supply, and blood supply. In addition, you should be able to name the anatomical structures that are related to the internal abdominal oblique muscle in the abdominal wall. This is the selected reference list which you can use for further reading. Thank you for watching and listening.